Oracare was actually created by 3 dentists. All of them were using chlorhexidine. All of them were hearing the same gripes from their patients and their hygienists, the staining and the calculus buildup. They were trying to create something that provided an alternative without these side effects. And Oracare was kind of born from there. The active ingredient, activated chlorine dioxide, has the ability to kill bacteria, viruses, fungi, it breaks up biofilm, and it reduces volatile sulfur compounds. So with all of those different capabilities, it has a number of different uses.
Brushing and flossing actually only gets about 22% of the mouth. So where a rinse can come in is it comes in and helps that other 78% that's getting left behind.
Oracare can be used for everyday care because it's safe while also being effective. While other rinses over the counter, if a patient would use some of those for an extended period of time, a lot of times they become ineffective because the bacteria can build a resistance with the repeated exposure.
Bad breath is caused by bacteria, we all know that, but it's also caused by bacterial waste, which are volatile sulfur compounds.
Oracare is fantastic for bad breath. One thing chlorine dioxide does incredibly well is remove volatile sulfur compounds as well as bacteria. Where Oracare comes into play with perio is that it is that tool they can add to their toolbox to be used on a day-to-day basis to slow that progression down. Oracare is better than chlorhexidine for a number of reasons. I would say the one that stands out the most to me, and I think that causes dental professionals to seek an alternative, is the staining and calculus buildup. For a long time, it has been the only choice. Oracare is now offering an alternative.
Post-op, patients a lot of times aren't supposed to brush and floss, but how are they to keep their mouth healthy? That's where Oracare can really help. It's an effective, easy to use, gentle rinse that patients can rinse once, twice, 3 times daily as directed by their dentist to help that tissue heal up rapidly post-op.
Having less plaque build up on their teeth while they have the appliance in there is so important, because if not, you get all of that scarring, that decalcification, and the breakdown. A rinse is so critical for an ortho patient to be using day to day. Dry mouth is something that plagues a lot of people. Oracare, in comparison to over-the-counter dry mouth, does help stimulate some of that salivary flow. Having the xylitol in there does stimulate the salivary gland.
Chemo and radiation is going to affect a person's salivary glands, which is the root of a number of oral issues.
The most common side effects are things like burning mouth, fungal infections, mouth sores, dry mouth. Luckily, Oracare is an aid that you can use to help with all of these things. Fungal infections are typically treated with a prescription mouth rinse. One unpopular part of utilizing that prescription product is actually that the patient has to swallow it. What Oracare provides is that same removal of fungi as this other rinse without having to ingest it. Plus, if it's someone who frequently gets fungal infections, this is a rinse that they can continue to use every day, long term. The reason I would recommend Oracare over others is because it's one of the only rinses that actually helps to kill viruses and fungi. And those are the 2 things that are really going to make you sick. A simple pre-rinse reduces contaminants and aerosols by 93%.